The COVID graph in Maharashtra as schools have reopened. But to talk more about the impact COVID has had on children and what we're seeing in this particular third wave, we're joined by Dr. Naveen Thakkar, Executive Director, International Pediatric Association. Thank you so much, sir, for joining us this morning. And I think this is a question a lot of parents have. There's been so much anxiety around children over the last 2 years with the pandemic. And what are we seeing in this third wave? What have we observed? Are infections increasing among children?
Yes, infection is increasing, but still we see that these are mostly mild or asymptomatic cases. So if we see the seroprevalence report of previous wave, particularly second wave, Delta wave, where seroprevalence revealed that children were infected before that time also. But still, what we yesterday I also had a lot of interaction. Still, there are. It's not that children are getting a serious disease or say hospitalization. Definitely, there will be, because the Omicron is so transmissible and number will increase so much. So there will be some increase in some absolute number, but still the children mostly have the mild or asymptomatic disease.
All right, sir. So another, question parents have, and now, like we saw in Maharashtra, schools have reopened. So what precautions should parents take to protect their children?
So that's a very good question. And throughout this pandemic, we have been arguing that schools should be last to close and first to open. So that's a very welcome step. And I congratulate Maharashtra Task Force for this good decision. And we also, we should never link vaccination of children with reopening of the school. We have to understand that there are many other ways where we can decrease or prevent the infection, which includes mask above 5 years of age, good ventilation in a school, which is most important, and they have to do reorganize like that. Social distancing, and keep watch on say if the children are having symptoms, to isolate them, and also immunizing the say eligible population and also the teachers. That's very important to reopen the school, and I'm very happy that Maharashtra is going that way. And it is very important because there are a lot of other damage. We know that Omicron is also mild, but still we continue to punish the children, and the indirect effects of pandemic on children are tremendous. We always say that children are hidden victims, and the biggest impact of pandemic is on the children, not on the adults, even if we calculate in any way. And there are a lot of data to support that. And unfortunately,
right,
school closure in India was longest.
Right,
so
it was the longest, in fact, 2020, and then 2021 also mostly schools were closed, and it's had a terrible impact on children, which will also still learn in years to come. But sir, you said, talked about Omicron being mild, and we've also been told that usually children are more resilient, they bounce back faster. The worry is, of course, that if they're carriers and they come back to their families and spread the disease there. But do we know more about how the variant behaves in children?
So that's a very good question. And what we have seen from original Wuhan virus to Delta, and now Omicron is still, we have to see the data. But from Wuhan to Alpha and Delta, what we have seen that children have mild disease. Second thing is the transmission potential of children is always low. It is always more likely from the adult to adult transmission rather than child to adult transmission. And also they transmit it for the lesser time. And but what we have seen that viral load increase from the say Wuhan to Alpha and Alpha to Delta, and maybe more. It may increase even in the say Omicron. And gradually, we cannot say that children don't transmit the disease, but still, when it is so prevalent, so much community transmission is going on. So we cannot just isolate one, when you are open, you have rest or everything other thing is open, and we just close the school. So singling out just pointing out to the children that they transmit, that's not correct. And definitely with variant, this is changing to certain extent, but still children transmit, but to lower extent and for shorter period of time. And there is always more possibility of adults giving infection to the children. And
Right.
with the vaccination status going up, this is slightly shifting towards down, but still it will always be there that children have less viral load than adults, whatever is the variant, and children transmit it for the lesser time.
All right, well, that's reassuring to know. And now with Maharashtra opening up schools, hopefully other states will follow, given, the local situation in those states. And yes, get those children back into classes. And, as you said, this has had a tremendous impact on children and learning across the country. Thank you so much, Dr. Thakur, for joining us on the program.